Hello friends, today I am going to discuss with you all about convergence insufficiency. So before proceeding to convergence insufficiency, it is very important to know what is convergence. So convergence. Convergence is a disjugate movement in which both eye rotate inward so that the line of sight intersect in front of the eye. Convergence remains same or constant throughout life. It does not change. But accommodation change, as we know that there is a fall of accommodation after 40 years of age, but convergence remain constant. But the convergence may change or deteriorate under certain condition. We are going to discuss it later on. Now look at this picture. In the right side picture, both eye seeing a far away object. That's why the line of sight is parallel to each other. And in the left side picture, both eye rotate inward. This is convergence. Convergence, we do convergence to see a near object clearly. Now convergence insufficiency. Insufficiency means not sufficient. So it is not sufficient convergence is there. So it is called convergence insufficiency. So convergence insufficiency is the inability to obtain and maintain adequate binocular convergence for a length of time. This is convergence insufficiency. So look at this picture. Here the middle line is normal convergence, but the red line where red line of sights are converting to see that near object, but it is not sufficient. It is focusing far away from the near point of convergence. This is convergence insufficiency. Look at this picture also. It is also same. Now the cause of convergence insufficiency or etiology. So it is the primary or idiopathic cause. The primary cause is not known, but it is assumed that wide interpupillary distance or delayed formation of ocular structure can develop convergence insufficiency in that eye. And secondly, refractive error. Refractive error, if there is uncorrected high hypermetropia or myopia, it can lead to convergence insufficiency. First of all, high hypermetropic patients. High hypermetropic patients who are wearing spectacles of more than plus 5.00 diopter, they do not feel, they don't need to do convergence to see a near object clearly, because the functions of convergence is done by their spectacle. So there is lack of convergence and it slowly deteriorate or decrease the amount of convergence and it lead to convergence insufficiency. Myopic patient, they don't need to do convergence and so don't feel any convergence necessity, so there is also lack of convergence. And if a full convex cylinder correction or full plus sphere correction, there is also lack of convergence is there. So that is why for them, for those patients, convergence insufficiency is seen. Now presbyopic patient, what is presbyopia? Presbyopia means decrease of or deteriorate the amount of accommodation after age of 40 years, that is presbyopia. And in presbyopia, the near point of convergence shifted farther from the normal reading distance, so that's why there is lack of convergence is there, so ultimately they lead to convergence insufficiency. Muscle imbalance, if the muscles are imbalanced, that means if the eye is deviate towards inward, outward, upward, downward in any direction, that means in strabismic patient there is a lack of convergence because the eyes cannot rotate properly to do convergence. That is why for the strabismic patient, convergence insufficiency is seen. And other factor I discussed, that wide interpupillary distance or general disability, that is delayed formation of ocular structure, can lead to convergence insufficiency. Now treatment, what are the treatment for this? Now first we have treatment, optical treatment, orthoptic treatment, prismotherapy is there, surgical treatment is there. So optical treatment. So optical treatment, first of all, in case of myopic patient we will do full correction. In case of hypermetropic patient we will do under correction, and in case of presbyopic patient full correction is needed. Orthoptic treatment, it include some exercise, that is advancement exercise and jump convergence exercise. Advancement exercise. In that exercise, we place an object in front of patient eye at a normal working distance or little bit further, where the patient is seeing that object single. Now we move that object little closer to his eye, and at a point the patient will see this object double, and we will tell the patient to some make pressure on his convergence to make this double image single. This is the advancement exercise, and we will tell the patient to repeat this exercise 8 to 10 times in a day until his convergence ability is improved. Now jump convergence exercise. In that exercise, what we will do, we will place an object at 6 meter distance and another object at 30 centimeter distance. First of all, we tell the patient to see that 6 meter distant object, and then instantly change the focus to far away object to the near object, that is 33 centimeter distant object, and we will tell the patient to repeat this procedure same 8 to 10 times in a day until his convergence ability is improved. Now there is prismotherapy is there. In prismotherapy, we place base out prism in both eyes so that his visual field is separated, and at that condition, if we place an object in front of patient eye, he will see double. Now we will tell the patient to pressurize his convergence ability to make that double image single, and we will repeat this exercise for 6 to 8 hours daily until his convergence ability is improved. Now there is surgical treatment is there, where medial resection of extraocular muscle is there to normalize the convergence ability. So that's all friends, thanks for watching, and please don't forget to like my video and subscribe to my channel. Thank you so much.